So, what are we looking at? Carla, what am I looking at?
Well, what you're looking at is, first, it's the MRI image, where you'll use to watch the MRI image, where we know that breast cancer enhanced on MRI images. And then the second image, that is a spectral CT image. And also with the contrast, the tumor enhances.
And you're purposely doing a 40 keV or a low mono E? Is that how you do this?
So what we've done is a phantom study and try to find in which the breast tumor is the most visible. So apparently 40 kV is most visible so it's most suitable for breast cancer.
And obviously this is an experiment. You're doing
it's
one
definitely
of the first places on earth trying this. What do you imagine the workflow being? A woman will get a mammogram and then come for spectral CT if this holds out? Or?
Well, we have some troubles with dense glandular tissue. So like for mammograms, if it's like really dense tissue, we can't see the tumor. And then spectral CT might be a solution. And also if we think about how painful it can sometimes be for women, a mammogram. So this might be an alternative in the future, but we have to do a lot of research for this first.
Also, MRI is not routinely available everywhere without lengthy waiting lists. I suppose in some places on Earth, if this proves to be the future, it might be a faster way to get into the troubleshooting from
well, that's another thing. I mean, MRI, we know it's going to take much longer than a CT scan. So, for example, we find out that we have about 5 minutes per patient right now. Well, if we do the contrast in a different room, but that's what we do for MRI as well. So, and for MRI, we can do at least 4 patients an hour. So that's a huge difference.
Savings, yeah. A lot of people may wonder, how did you stumble upon breast imaging with CT? How did this happen?
So when we got the spectral CT, I noticed a lot of patients got referred from my other radiologist. So they had like incidental findings in the breast.
Incidentalomas.
Yeah, and that's something we haven't had that before. Not as much.
So you were looking at spectral CTs of the chest and saw incidental breast lesions?
Yes.
On a spectral CT?
Yeah, on a spectral CT, and that's far more than just a normal conventional CT.
And that triggered you, well, maybe we're seeing more. So it sounds like you saw a lot of incidental lesions when you were just looking at standard chest CTs.
Yes.
And that triggered something in you. You were seeing more breast lesions. Maybe spectral was allowing you to see more. Is that why you initiated this study?
Yeah, and that's why so the first study, the phantom study, is it true that we see more breast lesions on spectral CT compared with conventional CT? And the answer is yes. Yeah.
When do you hope to publish something?
Well, we first have our abstract to the ECR, and we hope we will finish our 14 patients by the end of the year.
What excites you most about spectral CT?
Well, all the images we've seen up to now is that if we compare it with MRI, then we struggle quite a lot with the background enhancement, and that's a big advantage of spectral CT. So it lowers the background enhancement. That's actually what you see on the iodine image, the last image. Yeah, you see definitely less enhancement. And we know this patient because it's got operated. And the pathology didn't see anything else apart from the enhancement areas. So yeah, we're very pleased with that.